Hello, my name is Brian Suffoletto, and today I'm excited to tell you about our CTSI T1 T2 pilot project entitled Sensor-Based Markers of Drinking and Impairment. Can smartphone sensors identify activities associated with drinking among young adults? But why should we care about drinking in young adults? Well, they have the highest rate of hazardous alcohol consumption among all age groups and suffer disproportionately from alcohol-related injuries. As you can see in the top figure, the young adults have the highest percent of those that are both binge drinking as well as using heavy alcohol. In the bottom figure, you can see even on college campuses alone, binge drinking results in 1,800 deaths per year, 600,000 injuries, millions of drunk driving incidents, as well as numerous other assaults and unsafe sexual encounters. We've been doing this work for a while, focusing on reducing hazardous alcohol use in young adults. One of our biggest trials to date is called the TRACK trial. We recruited 1,800 young adults between 2012 and 2013 and randomized them to one of three different arms. Our intervention called TRACK, the SMS assessments, and the control arm, which received no text messaging. So what did it look like? Well, it's an interactive computerized program that every Thursday and Sunday sends messages, and based on the responses from individuals, responds. It uses branched algorithms and some basic natural language processing to provide intuitive, seamless communication to affect change in young adults. So what did we find? In this trial, our intervention, noted by the triangles in this figure and the dotted line, what we found was that from baseline to 3 months, they had the largest decrease in drinking among all the three groups. As well, we found that these results were durable over time, out to 9 months, which was 6 months after the intervention ended. Subsequently, we've been funded by the NIAAA through an R01 mechanism to conduct the MATCH trial. And the purpose of the MATCH trial is for us to figure out, number one, what text message components are needed for change, and number two, what mechanisms are those that are important for change within individuals. Over the next 4.5 years, we're going to be recruiting over 1,875 young adults. We're going to be randomizing them to one of 5 different arms, 4 of which contain different components of our text message intervention. Not only will we be looking at how these different interventions affect outcomes out to 6 months after the enrollment, but we're also going to be examining mechanisms. Based on the dual process model of behavior change, we're going to be focusing on both drinking cognitions, including drinking intentions and a desire to get drunk. And you can see how we're going to be recording this through the text message itself every week, as well as those 3 occasions per week that they typically drink the most. As well, weekly, we're going to be studying implicit biases over a 12-week period. We're going to be using the alcohol Stroop and the approach avoidance tasks through a web-based app platform to collect those data. But now we're sort of asking ourselves, is this enough? Should we push our innovation even further and try to understand how individuals change not only their cognitions around drinking, but their actual behaviors? And we propose a novel idea that we can use phone sensors maybe to help us understand drinking behaviors. In this picture below, you can see that in each individual on your phones, you have a number of powerful sensors like location, movement, phone apps, ambient light, microphones, communication logs. And these relate to low-level features as seen in the yellow, which can be like location type, movement intensity, paralinguistic information, social activities. And these relate to higher-level behavioral markers like hedonic activity, concentration, depressed mood and stress, and social avoidance. So now we're sort of asking ourselves, can these phone sensors actually help us understand drinking behavior? Well, in the past year, we've worked with our partners at CMU, and we've uploaded the AWARE app to collect this sensor data on 38 young adults with past hazardous drinking. We've examined to date a total of 293 days in these 38 individuals. And as you can see in the figure below, we were able to capture a number of both heavy drinking episodes or binge drinking episodes, regular drinking episodes or non-binge drinking episodes, as well as in the gray, the non-drinking episodes, over a 28-day period for each individual. Not only that, but we've done some work using machine learning to see if we can actually detect drinking episodes using these sensors. And so we used a training set, a cross-validation set, as well as a testing set. And we found that indeed we actually can identify drinking episodes just by using these sensor data with good accuracy as well as precision. We found that among the 20 different categories of sensor features that we can collect, we can rank order their importance. And we found that some features are more important than others. But this was very promising and makes us inspired to continue to try to use sensors to identify drinking episodes. Not only that, but we conducted a separate experiment in 10 young adults with a range of baseline characteristics. And we uploaded an iOS app to their phone using the health research kit, where we collected both gait and balance during drinking episodes. And we worked with our partners over in the School of Information Sciences at Pitt to try to identify the sensor features associated with gait impairment during drinking. And again, using machine learning techniques, we found that there's indeed patterns which we can identify in the actual using phone sensors to identify aberrations in gait during drinking episodes. Again, very promising findings, and which leads us to want to seek further resources to continue this work. So this is where the CTSI pilot study comes in. What we propose in this T1, T2 pilot project is to enroll 200 of our match participants, and this will equate to about 40 per treatment arm of those 5 treatment arms. So we're going to leverage our existing R01 grant and the research infrastructure to recruit these individuals. We're just additionally going to have them consent and to upload the Aware application to their phone, where we're going to collect the sensor data over a 12-week period. And again, we're going to be collecting categories such as activities, social, location, device interaction, and device information from these individuals over the 12-week period, while we're also tracking their drinking. Our first aim is to develop a parsimonious model utilizing this digital marker data associated with drinking episodes. And our second aim is to explore whether these digital markers on drinking days differ between these treatment arms over time. We believe that this project is innovative in its purpose, and that we're looking to improve models of behavioral prediction. We're using an underrepresented youth sample. We're also using novel sensors and machine learnings, as well as looking at event-level drinking in our outcomes. We believe that the impact is broad-reaching. We can build algorithms to help detect hazardous drinking episodes and build dynamic models that can change over time, as well as to develop just-in-time harm reduction interventions. This pilot data will be absolutely essential as we put together proposals in the coming year for both an R34 and a U01, both to the NIAAA. The CTSI, we're looking for support from the CTSI to provide the resources, not only to pay individuals, those individuals who we enroll, to cover their data plans over the 12-week period, but as well as to pay graduate students both at CMU and at Pitt to conduct the data processing and analysis. Our team is a diverse group, an emergency physician, myself, a clinical psychologist, Tammy Chung, and geographic information scientist, Hassan Karimi, as well as human-computer interaction specialist, Aninde and Grace Bay. I want to thank you for your time and attention. Thank you.